Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program.
Learn how the medical office team helps in this edition of Helping Seniors. Noted periodontist Dr. Lee Sheldon joins Helping Seniors TV host Joe Steckler.
Welcome to this edition of Helping Seniors. My guest this morning is Dr. Lee Sheldon, and Dr. Lee Sheldon is an orthodontist.
No, I'm a periodontist. You've known me for how long?
I just wanted to see if you were paying attention.
All right, I'm awake. I'm awake. I just got back from vacation. I remember what I do.
Periodontist goes down into the gum, and an orthodontist takes it out?
No, orthodontist straightens teeth.
Oh, straightens teeth?
Yeah. Periodontist is involved with overall treatment planning and taking care of gum disease. Gum disease is either the first or second leading cause of tooth loss, and we can prevent many people from losing their teeth if they just get to see a periodontist soon enough.
We eventually will get into talking with some of those things as the show progresses. I know we will. But the central thing we wanted to talk about today was the importance of the management team, the leadership team, the office team in administering and sort of ensuring that the client not only gets follow-up care, that they want to receive follow-up care. And the reason I can talk about that is because I am one of the worst, absolute worst, and I admit it, I don't follow up on my dental care.
Okay.
But I've been blessed that I've had some good dentists. You one.
Thank you.
And the good Lord has given me some good teeth.
Yeah.
So.
And if not, we figure out a way to give you some anyway.
I know. You put some bound in there and they come.
That's right.
And they work. They work. I can chew with them.
Good.
And I asked somebody recently, I said, are you afraid to talk on the radio show or the TV show because you're afraid your teeth might fall out? And they laughed at me. They had their own teeth.
Yeah.
But, Lee, you can joke all you want about dental care, the importance of dental care, and the importance of management. But when you get into any type of medical care, having a good medical team and leadership team is so important.
It is, and we don't give our teams enough credit. And part of what we do, as you know, is to teach management to other periodontists and other specialists around the country. Right. But the importance of the team and the importance of leadership of the team and giving guidance, but allowing the team to expand as far as they can, as far as they're capable of, makes it better for me and frankly makes it better for our patients.
But when you say allowing them to expand, what do you mean exactly by that?
I'll give you a specific example. A dental assistant goes through dental assisting training, which usually lasts 1 year. And they are taught that you cannot diagnose. You're not allowed to diagnose. Diagnosis is reserved for the doctor. And so they come into the office afraid to say anything. My feeling is completely the opposite. I want my assistants to diagnose. Now, I don't want my assistants to tell them the diagnosis, tell the patient the diagnosis, because obviously diagnosis comes from me. But unless the assistant can think through a case all the way through and think like a doctor, then the assistant is reduced in her capability. If we bring them up to the point where they can read x-rays, understand position of teeth, understanding what periodontal disease and what impact it might have, they can be in a much better position to help the patient. Because when it comes right down to it, the patient is going to spend a lot more time with the dental assistant than the patient is ever going to spend with me.
I'm trying to think about all. But when you get into the business of in certain parts of dentistry, I'll agree with you, but when you get into specialized care areas like dental implants,
Yep.
what the doctor establishes or the plan he lays out is extremely important, and no assistant can do that.
You're absolutely right. What I want to do is to increase the assistant's thinking skills. Understand, you're not coming into the office, you're not coming into my office because of my assisting team. You're coming into the office because of me. But for me to be able to work effectively, I need to have an assisting team who's educated as well as they possibly can be. So if somebody comes out of dental assisting school, which is 1 year after high school, or they come to see me, which is 10 years after high school, obviously there's going to be a difference. But unless I ask my assistants to think in terms of diagnosis, to think in terms of treatment planning, and to have some basic understanding, they're going to be in more of a menial position. And therefore, if you have a question for the assistant would be thinking in that condition at a lower level. But if I encourage my assistants, if I train my assistants, if I show my assistants how to look at all of the things that we do, all the diagnostic things, whether it's CT scanners, study models, or specialized software, or regular x-rays, or periodontal probing, or anything, and have them understand the meaning for that, they can do a lot better job for you. Besides that, they feel they're expanding, and everybody in every aspect of life wants to be able to feel as if he or she can grow.
Well, let's just take the case of a person that thinks they need a dental implant.
Yeah.
And they go in. I knew I needed a dental implant because my bridge I had came out.
Right.
So, and since you're been on the radio and the TV show with me for years, I knew that I had to come see you because I didn't know there was anybody else was going to work on putting anything down in my gum again. But I think it's so important that we do a better job of recognizing the importance of this team aspect in dental care. And the reason I say it is because I have in my own area of going to doctors, I've watched the staffs change.
Yes.
And I've watched what I perceived as being very, very good assistants, nurses, and then I find that they've been replaced by somebody else, and I make a call and try to let the people know what's happened and why I wouldn't call them unless I needed help. And I find that some of the nurses are not as responsive as others that people thought were maybe too outgoing. Have you experienced the same type of thing?
Of course I have. And part of that is selecting the right person. And we don't always select the right person the first time. But there are certain methods of interviewing and certain testing that you can do to kind of weed out who might be the good person or the bad person. The second thing, though, is to develop training modules, whether video training modules, we're essentially doing a video training module of a type right now, or whether we're talking about written modules, we have a system of written materials. You know, we've written a book, and every one of my assistants and every one of my staff members has to read that book. That's part of the training. There's a certain amount of ethics training that we do as well. What's allowed, what's not allowed. And there are videos that we've created specifically to make sure that that person, and I'm talking about whether it's a trained assistant or whether it's untrained, that there's a sequence of education that that person goes through, which might last 6 months or longer, in order to be able to get that person on board so they can be an effective member of our team.
You brought up, you're talking about your book, The Ultimate Mouth Manual.
Yeah.
Are you on your third edition now?
I finished my third edition.
You
yes.
finished the third?
Yeah.
Okay, when am I going to get a copy?
I'll get you one.
Okay, I'll hold you to that.
Okay.
Because have you expanded on material that was in edition 1 and 2?
Yes, I have. There's certain specific, there are changes that have occurred in dental care, particularly in dental diagnostic care and surgical care that we've been able to expand. And I asked my associates to write additional material. So my son, Dr. Matthew Sheldon, who's a general dentist and can expand the restorative part of the tooth part of the Ultimate Mouth Manual. He was in charge of that. And Dr. Michelle Furtado, who's our board-certified periodontist, was able to expand on some of the new diagnostic materials that he's been able to do to help patients get through their surgical procedures much more predictably and much faster as a result of the things that he does to pre-plan every surgical case.
You know, Lee, I think what a lot of our viewers don't understand, or maybe don't, it's not that they don't understand it, we don't give enough importance or enough emphasis to the importance of understanding what it takes to put together an effective dental practice.
I think you look at that, but you also look at any system or any successful organization. The organization does begin at the top. In other words, the person who's in charge of that organization essentially sets the standards for that organization. But then there's implementation of those standards. I couldn't do it without Danielle. Danielle's an office manager, and she has the best needs of the patient, also the best for the staff as well as the best for me, always in her mind. And when things are going well, she's expanding on that. And when things do change for the negative, and they do from time to time, we all slip, then she has to be able to look at that and be able to detect it early and then find out what correction needs to be made. One of the biggest things that Danielle does is to keep the tone level of the office high. Patients don't like coming into us, into a dental office, but if you can keep a happy tone level throughout the day, patients feel much more comfortable as a result.
You mentioned that, and one of the things that we wanted to talk about today was what exactly do you mean by tone level? I think I know what it is, but you know, when we do television shows, doctors have different connotations as to what something means or how it affects others. And when you talk about tone level, a lot of people might think about the level of noise in the office.
Right.
Or what exactly do you mean when you say tone level? What do you really mean by
It's
that?
an emotional tone. It's how a person expresses himself, actually how a person feels internally. So that if we look at a low tone, which particularly in the dental office, a low tone might be considered fear. People walk into the office their first time, they're afraid, particularly afraid of the unknown. That would be considered a low tone. If somebody is enthusiastic, that would be a high tone. And there are different gradations of those tones in between. This concept was developed by L. Ron Hubbard probably 50 years ago in terms of qualifying what those tone levels are. Our goal is to be interested and enthusiastic so the patient can get out of that fear area and get to the point where they're interested in their own care. And if you walk in and you're fearful, all you're thinking about, what are they going to do to me? What's going to happen? If we can work with those tone and gradually bring your tone up to the point where you're actually listening to what I say and can appreciate what I'm saying, and we've taken away the fear because we've taken away anything that would cause any fear, then you can be much more involved in your own dental care. You have to make particular decisions. Not everything is a single decision. There are multiple choices when you come into complex dental care, and you have to be able to think with us in order to be able to allow us to help you.
I would have been very concerned when I came to you and you told me that the teeth that were in here had to be extracted, and then you grew the bone so much they had to cut stuff off to get so that the implants would fit. But when you talk about fear, I think of remember the old Singer sewing machine, the treadle machine that you worked the foot treadle to make the. You don't remember that?
No, I remember the electrical one. There's a foot treadle.
The one before the treadle machine.
There's a treadle dental machine too.
Well, I know, that's what I was leading up to.
Good.
And they had the old treadle dental machine thing. I can remember to see that thing go up like that with all those pulleys and everything. And the dentist got that thing closer. And when it seemed like some of the bits were kind of like drills. I see that when you drill a hole in a masonry wall with a bigger bit, it had bigger chip things on it, and it kind of looked at and reminded me that's what that dental drill looked like. But dentistry has advanced so much over the years, and I don't think that. Well, I think that a lot of people that really truly need to see a dentist are still afraid to see a dentist.
You're right. And Our practice is a practice that specializes in those kinds of patients. Many of the patients who came in, maybe most of the patients who come in, had given up on dentistry for one reason or another. And then finally, they're forced back into it. They finally say, I've got to do something. My breath smells, I can't chew, I don't like the way my mouth looks, whatever that is, or they need another opinion. And they finally have gotten to the point where they say, all right, I've got to go in, I have to find somebody who can help me in my particular condition. Well, that's different from the person who's been seeing the dentist every 6 months and is in the system. We're seeing patients who are out of the system. And so when we talk about phone level of fear, yeah, many of our patients walk in, they're scared to death. And so we have to be able to deal with that first. And the staff in particular has to be able to help that patient overcome that, because we pride ourselves on not creating the same experience that allowed them to leave dentistry in the first place. You have to work with that first before you can ever get into the dental part of it.
Well, the reason I think, one of the reasons I think about what we're talking about this morning, Lee, is that I've dealt with homeless people. I've been associated with many people that simply live from paycheck to paycheck, from Social Security check to Social Security check. And I've looked at their mouths, and I've seen the decayed teeth, and I've seen, I knew just as a layperson that it required extraction. Now, whether or not you extract the teeth and just put a set of dentures in, or you can, well, people were in that shape. If they just could afford to get that stuff they had in there out and a set of clean dentures put in would be a step in the right direction.
Sure. Yeah, and that's the first step. That's the elementary step.
It's the elementary step. But it's just a shame to me that our country has not recognized the importance of our government. If you want to use the word government, I hate government interference and all this stuff, but we need to do a better job of thinking how we can make dental care accessible. I don't want to use the word affordable. I want to use the word accessible. And I think that we need a stronger voice among dentists, and I have them leading up to this for a reason, because I know what you're doing. I think we need to make a stronger case for selling the importance of mouth care to the general public.
Well, we know the mouth care is important now, not just because of teeth, not just because of gums, but because mouth care has very much to do with overall health. We have,
right, especially this thing.
Yeah, we've got heart disease, we've got diabetes, we've got kidney disease, we've got Alzheimer's disease. Every time we study a disease in relation to dental disease, we find a positive correlation. So certainly we have to be able to help people to get this healthier in order to at least, I'm not saying this is causing everything else,
right,
but this could be contributing to overall health problems. And so we have to be able to take care of this area first.
Okay. But we're talking today about the importance of staff, and we're talking about success rate and keeping staff. Who makes a rate and why is that important? But that's one thing. And but let's relate this to something maybe on more on a national/international level. You as a dentist, a periodontist, have recognized the necessity to try to, for us in the United States, to access what some of the other countries are doing. And are you still involved in trying to develop those programs so that you, in the art of teaching or making periodontal care? When you went to Spain and you were doing some of these other things, are you still doing all that?
Oh, we're still doing training, outside training, in order to be able to elevate. In Brevard County, we want to be able to provide the best of dental care, and so yes, we have access to a number of different areas in order to be able to do that, including.
And I want to go a step higher now. How would you rate dental care in Brevard County in comparison to the dental care that you have gone out and you've spoken at forums and conventions outside the United States?
Well, I think you're going to find a very level of care in every community. I don't think Brevard County is better or worse than any place in the United States. I think you have your upper level dentists and you have your lower level dentists. And the lower level dentists may be the ones that we're talking about, that who could provide denture care, but may not be able to provide the sophisticated care that we're talking about. There's a difference in dental care and medical care. You can seek the denture care or you can seek the dental implants. There are different spectrums here. And there's some dentists who are very comfortable treating at this level, and there's some dentists who are very comfortable treating at this level. I think in Brevard County, you have all of those levels. It's just a matter of finding the person who can do this level of care, or this level of care, depending upon what you're seeking, what you desire for yourself.
And my problem is, and all the senior programs I've been involved with over the years, I've recognized that there is so many people, Dr. Sheldon, that simply don't know where to go or how to access this type of care.
It is difficult, and we've experienced that, particularly when we started going directly to patients. As you know, we had a very big referral practice for most of my career. The big discovery that we made when we started going directly to the patient was essentially there was a whole group of patients who didn't know where to go, and for whatever reason, either because of advertising, or they've seen me on shows like this, or they've seen what we've written in newspapers and magazines, things like that, and say, well, he sounds like the expert, maybe I'll give him a try. And then I didn't realize how large a group of patients there were. After all, I was working in the referral group, so they were seeing dentists on a regular basis, and okay, they needed to be referred to their specialists, like came over, they were referred over to me. But there's a much larger group of patients out there who had decided not to seek dental care, and they're looking for the expert. They'd become disenchanted with dentistry for one reason or another, and we all know what those reasons could be. And finally, they have to find out where to go. Well, it's difficult. There's nothing that credentials me except for the fact that I'm a specialist. People don't even know what a periodontist is. What's a periodontist? Yeah. And so then finally they say, oh, well, he's a specialist. I know that I see a specialist when I have complex medical problems. Maybe if I see a specialist for complex dental problems, maybe it works the same way. And the answer is yes, it does work the same way.
Now think about what we're talking about. Now, the questions I've asked you, we're talking about international talks, forums, conventions, trying to find out what other people are doing and how to bring that back to Brevard County. And let's go back to what the title of our show was today. The staff may be the key to your dental experience.
True.
Why?
Because the staff can make the difference. If we're talking about experiential treatment, if we're talking about communication, answering questions right away, knowing when you can answer a question and when you can't, understanding what the doctor says, because I'm going to give my treatment plan. It might take me a half an hour to do the presentation, to go through all of the diagnosis and treatment planning. But then the patient has questions. The assistant needs to be able to guide that patient through the questions, which might take an hour, 2 hours, 3 hours, 4 hours, unless that dental assistant, and by the way, it's not 4 hours all at one visit, but people are ready to receive a certain amount of information, and they have to digest that first. And then they are ready to receive the next packet of information until they can finally make the decision, because there are treatment alternatives. Unless we have a staff member who can communicate well and communicate effectively and can communicate with answers and understand what the patient actually wants. And unless we have a lot of friendliness going on, that person who was disenchanted to begin with may become disenchanted again. Well, if that's the case, we've lost, and the patient's lost as well, because the patient now doesn't have an opportunity for treatment. So we have a staff who's well educated and likes what they're doing and likes patients. Then they make it the treatment they need.
It's like the old, like in the Wild West days, they say, now we'll circle the wagons.
Okay,
we're going to circle those wagons. And we go back to the fact that once we got those wagons circled with a good, effective staff, what does that do? It lets you, the guy who's the most experienced of your son and Dr. Furtado, my memory's still good. Okay. I remember it's Dr. Michelle Furtado, and how you pronounce, because he's French, and it's Michelle. But having those two dentists, that you feel very comfortable that they're able to do what you want to do, that then lets you, the guy that started the practice and has been through all these training forums, that lets you sort of come back and say, I can focus my time now on treatment plans, how to make the more effective use of my son's talents and Michelle's talents, and sort of sets a tone for what the staff thinks they can do.
It's true. It's true. As we start at the beginning, we always want to be able to grow. My position of growth is obviously running the practice, but it's also to help others run a practice effectively as well. If we can do those things, and the more I get out there, the more I hear of problems, I'm able to not only provide solutions, but also they provide solutions for me because they're doing some things that are a little bit different for me. It's a co-learning experience. The result always, no matter how we're doing it, is to make sure the patient is treated well and treated effectively.
But have you found, since you've been able to do this, has that caused you to get away from the actual practice of dentistry? I know there's no way you can do what you're doing now and do as much actual dentistry as you did before.
Sure.
But are you still keeping your hand in?
I'm keeping my hand in terms of diagnosis and treatment planning. Active dental treatment, no, I'm not doing that anymore. I've got two doctors who can do that very, very well. And if they have questions or if they want an opinion, if they want me to check something, I'm there to be able to help them out. And I do supervise what's going on in the practice. For me, at this stage, it's teaching, writing, and being able to create environments to get lots of patients to the point where they can get the best experience.
But I have one last question.
Yeah.
With all your training, with all your skills, would you still feel comfortable if an emergency arose and you had to go back and do all that you did before? Would you still do it?
I could still do it.
You could still do it?
Yes.
Well, that's nice. That's nice to know.
Thank you.
Thank you, Dr. Sheldon, for being here on the show today. I really appreciate always having you on the show.
Thanks, Joe. It's always a lot of fun.
It's great to do that.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.